Cox Business Television, information and insights on the Hampton Roads economic picture. Featuring in-depth interviews, profiles, and the latest publisher spotlight from the newsroom at Inside Business. Exclusively for Hampton Roads, Cox Communications presents Cox Business Television.
Hello and welcome to Cox Business Television, presented by Cox Communications. This program was created to help business leaders improve your situational awareness as we navigate through challenging times. We examine what's happening around you and your business and hopefully help you to be a more impactful leader. In short, leaders helping leaders. Today we revisit the issue of healthcare and the inherent risks and opportunities that reform will bring to both large and small businesses alike. During this show, we'll continue the conversation that began at the recent executive discussion series held in Hampton. Our panel of experts focused on the strategies companies need to be prepared for new healthcare legislation. And with changes massing on the horizon, the news was there's no time to wait. Today in our studio, we'll talk with several of our panel experts and hear more of their insights and recommendations, and how one company in our area is leading from the front. To start off with, I'd like to welcome Gary Brandt, Chairman and CEO of Maritime Holdings. Gary, you really showed us a whole new way. At this series that we had, you embraced healthcare and really started something kind of radical in this area. You mind sharing us a little bit about that?
Sure, Mike, and thank you for inviting me this today. It's a very important topic and it's near and dear to my heart. Basically, our company is AMH, American Maritime Holdings. We're an employee-owned company, which makes things a little easier because everything we do is for the company. Right. About 7 years ago, I had a vision that the way healthcare was going, and I was involved in the renewals in healthcare, and every year it was going up and it was going up, and we were having to cut benefits and try and move here and move there. And basically what I tried to do is, and I had this vision that wouldn't it be nice if we could bring healthcare into our workplace? Okay. Well, in 2 years ago, we merged our companies, had 3 companies come together, and then decided that we were going to go ahead and act on that vision. And what we were going to do is we were going to open up our own medical facility, providing health care to all of our employees and eventually to all of their dependents. Gracious. And so what we did, the first thing we had to do is, well, we have the vision, now how are we going to enact it? Right. So we had Mercer Group do a study for us. We looked at some other areas. We knew that there was a shipyard in South Carolina that was cutting edge, that had taken it upon themselves to go ahead and provide a clinic for their employees. So we flew down there, we looked at it, we liked what we saw, and we used that as a model. And then the next challenge was, well, we have the vision, we've seen the model, now how do we staff it? So we ended up hiring Dr. Mark Gaines, who has been an internist for over 30 years, who has an impeccable reputation. So we said, now we're going to have the doctor, and that's one part of it, but now what are we going to do? Because prescription drugs are so expensive and such a big part of the cost, we decided to get a pharmacist. So we scoured the region and we found a pharmacist, Rebecca, and a staff. So we now had our medical staff in our group, and we signed them on to a contract. And so we said, okay, now we're going to have our staff. Where are we going to put it? Right. So we went over to Chesapeake in the Berkeley area, and we built our medical our clinic. It's about 2,800 square feet, has 4 exam rooms and state-of-the-art equipment in there. And so what we did was we built it, and in May 1st, we opened the clinic and providing health care.
And you were saying that already for the folks that maybe have either infrequently seen a doctor or maybe have never seen a doctor, that you're having real impact on their health care of your employees. Can you share with us a little bit about that?
Sure, and I think one of the important things is the vision. You know, we can talk about the healthcare reform and the cost and everything to companies, but there were 2 reasons I wanted to do that. One certainly is cost, and cost is very important. The other issue is taking care of the people that are the company, the employees. You know, we're in a business where the average age is 48 to 50 years old. Mike, if you have your car and it gets old, it starts breaking down, doesn't it?
Exactly right.
It's one thing to put a patch on it, it's another thing to repair it so it lasts a long time.
Right.
Well, our employees deserve the best, so what we decided to do was that we would not only do primary care, but we would do wellness checks, that everybody in the company would get a wellness check, another name for a physical, and do a complete battery of tests, complete screening, so that we can get them on a playing field. We can develop metrics. And so what we can do from that is we can work on their health so that their health improves, they become more productive, they work safer, and all of that. And so we did that, and we did our wellness checks, and we've gone through over 500, almost 600 wellness checks. And go ahead.
So like you mentioned the metrics, and since we're talking essentially to executives, what are some of those key metrics that both you were trying to measure? What were some of those key findings that you're finding after the first 90 days? Business drivers.
What we found is, number one, most people have not had a physical in 10 years.
Wow.
Okay? So number one, we found out of our initial, we found 119 hypertensions. We found, I think it's 20 now, diabetes. In fact, we had a person that came in, and I want to make it clear that this is all HIPAA. So I don't know any names, I know numbers and names. But last week we had someone who had come in whose sugar was 334. The doctor found an aneurysm last week. We have found a prostate cancer. We have found a skin cancer. We found somebody that needed quadruple bypass, went right from the exam room to the hospital to a bypass.
So you're having a huge impact on the daily lives, and yet doesn't seem to be a negative impact on your bottom line or the finances. It's actually improving because you're saying it. I believe that you're saying that some of the other costs were coming down. Can you share with us what you saw?
Yeah, the big thing is the cost as far as the pharmaceuticals. When we're going out to, if you go to Walmart and buy a prescription for $4, a lot of times I can buy that prescription for 38 cents.
Right.
So it has been such a benefit that all of the generic drugs, which we're trying to get up to 85%, we give free. There is no cost. And Tier 2 and Tier 3 drugs, we have a very low copay. Wow. So what all of the employees are seeing is not only can they come and get their checkup and come into a sick call as a primary care, but they get their prescriptions at literally no cost.
Gary, we got about 30 seconds left. What would be your message to fellow CEOs and business owners around here in kind of to close down what you would challenge them to try to do here?
My challenge to them would be proactive and not reactive. Don't wait on the government or don't wait on somebody to tell you what to do. What you need to do is you need to step out, you need to take the risks, you need to invest in your people because in most cases the people are the best resources. They're what drive the company.
Thank you so much. I mean, your leadership, we appreciate that. Thank you for being a blessing to your company and to this region, and I wish you all the best going forward.
Thank you very much.
In our next segment, we'll talk with two experts on the rules, the regulations, taxes, and tax breaks. But first, here's more insight from the Executive Discussion Series. Stay with us. You're watching CBTV.
We pay about 75% of healthcare costs for our associates, and our rates are going lower, but we're going to make that up by pushing costs to associates from a point of service standpoint. So when they go to the emergency room instead of their doctor, they're going to have a higher copay, or they have a procedure that's going to incur additional costs. The intent is to help them think about that. So we're struggling with how do we balance the cost at the same time trying to work with our associates so that they can make better choices and not be as impacted by those dollars.